Hello, everybody. Welcome to another FUH podcast today. Here is Dr. Omer Al-Derwish. I'm consultant urological surgeon, and I'm pleased to have my colleague, Dr. Mohammed Raafat, our consultant vascular surgeon. Today, we are going to talk about an important topic for the occasion of the month of men's health. We're going to talk about early onset erectile dysfunction in men. Dr. Mohammed, can you please highlight some of the vascular diseases that can increase the risk of erectile dysfunction in middle age or younger age men, please?
Thank you. Welcome, everyone. Thank you, Dr. Amr, for this nice introduction. Of course, men's health is always related to erectile dysfunction. And as Dr. Amr mentioned, we'll be discussing the early onset erectile dysfunction. Many of the causes that may end up giving patient erectile dysfunction are related to vascular issues. The vascular system is mainly arteries and veins, and both of them could be affected that may lead to this disease or this condition. There are general problems that might affect the vascular system and lead to this problem, and there are some local problems that might affect the blood vessels in that area, which would result in this problem. Some of the general problems are the diabetes disease, which affects the general blood circulation and could lead to erectile dysfunction, as well as lack of some nutrients and vitamins, specifically vitamin D and its effect. Also, the problems with the lipid or the fats in our blood circulation, the hyperlipidemia, may also lead to this. This is more about the general problems that would affect our vascular system. The more local problems that affect specifically the blood vessels of this area would be more into the what we call ischemia or malperfusion, the lack of blood supply to this area because of diseased arteries. That could happen after smoking or diabetes, or the other way around, that could be from something termed venous leakage, which means that the blood vessels that drain this area of the pelvis are not keeping the blood for a time long enough to maintain a proper erection in that area.
Thank you very much. Now, we know that when a man comes in with this kind of problem, sometimes they did not have any previous consultation or checkup. And if they have early onset erectile dysfunction with some other alarming symptoms like occasional chest pain or shortness of breath or something like this, then this might be an early sign of more serious vascular or cardiovascular disease like coronary artery disease or arterial dysfunction. How do we address this kind of situation?
So again, we need to be able, so the patient needs to get a professional advice, and usually the first stop is a urology clinic or a specific clinic for that, where they would check, is the cause most likely to be a local cause affecting that area or a general cause, as you have mentioned. If it's a general cause, it will be more into checking his blood tests to check for the nutrients and vitamins. He might need some tests on the heart to check its functions. Some other simple non-invasive studies to assess the blood flow in the lower limbs, which would indicate if there is a lack of blood flow in the pelvic part. A much more specific diagnostic test is done once we suspect that the problem is within the local vessels, which is called a penile ultrasound scan, which is done in a specific setting. The patient needs to have a local injection of a medication that will initiate the process of action, and it will be checked with the ultrasound to assess the blood flow during that phase.
Thank you. Now, a lot of our patients are not aware of the causes of early onset erectile dysfunction, which from our prospect, we normally say there are three possible causes for this. It could be organic or something related to the general health. It could be hormonal related, like if they have low testosterone level, or sometimes even psychosexual or psychological or mental cause, like particularly in our days, there is a lot of stress and anxiety, and some people will have erectile or erection problem only because of their mental status or a stress situation that they are facing. So from our perspective, it's very important that if a man has an early onset erection problems, they should come and consult us so we can be more like specific about the cause. So this will involve some, of course, interview, asking questions, and examining the patient for any signs of low testosterone level, for example, or any systemic disease like obesity, dyslipidemia, or undiagnosed diabetes even. In addition to that, sometimes even psychological assessment, where if we exclude any organic causes or low testosterone level, then sometimes we need to even seek a professional advice from a person who is specialized in this, like a psychosexual counselor or a psychiatrist who have a special interest in this area. Do you agree with me, Dr.
So very well said, Dr. Omar. Actually, this is an issue that we might face more commonly in our culture and in our area, where men would feel embarrassed or they would feel shy to express that they had such issues and such problems. And probably they would put in the back of their mind that if I go to a doctor, I have a disease, I will go into a big issue, I will be exposed. First and foremost, everyone must know that these issues are protected by the patient-doctor relationship, and there's a privilege that the patient will never be exposed. The data or their medical condition will never be exposed.
Yeah.
So they should not feel shy, nor ashamed, nor embarrassed to seek help.
Yeah.
As you have mentioned, there are many causes, and sometimes it's just a simple talk about how to improve your lifestyle, how to get proper sleep, how to eat properly, how to be in the proper conditions that would alleviate the patient's mood, and that's the issue is solved. Sometimes they need professional advice. But I will definitely encourage everyone who feels that there is a problem, it's not something to be ashamed of. They should be seeking professional advice because there are too many solutions.
Absolutely, I agree with you. What is your thought about men who go straight to the pharmacy or to consult their friends or a relative about treatment, and then they go and take treatment without consulting the specialist?
We are in an era where information is available to everyone. Everyone has a smartphone. Everyone can just push the button and check over Dr. ChatGPT or Google and ask them what happens.
Correct, yeah.
I falsely call them doctor. They are not. These platforms would give them raw data, and there is a very big difference between raw data and between applying the raw data. I'm a bit biased. I believe that people should not confuse raw data with our medical degrees.
Correct.
So the raw data is there, but how you apply this raw data to this person by understanding what they have and talking to them and finding out all the details is what the doctor is supposed to do. So I will, again, strongly advise against taking medications without a prior consultation with a professional and without seeking doctor's help. You, of course, we all have the right to knowledge, and checking it and knowing and reading about it is actually important because this helps the patient understand what's happening.
Mhm.
But to seek to take medications or supplements without proper advice is something that I would advise against.
I agree with you. I mean, there is also another very risky practice, like if they take medication and they are already taking medication, for example, for their blood pressure or their heart, there is serious interaction between these drugs that can cause life-threatening complications. In addition, of course, to the risk of taking the wrong medication altogether, which can lead to side effects and maybe cause another problem in addition to the issue that they're facing.
Definitely, what you said is a very important part, because these medications, they also affect the vasculature, and if someone has a problem with his heart or blood pressure, some of these medications could lead to a severe drop in blood pressure, and we see that some of these gentlemen unfortunately arrive at the emergency department because they decided to take the medications without proper advice.
Correct, yes. There's another wrong belief or myth that once you start treatment for this issue, you will take it forever for all your life. But then what we tend to encourage and promote is lifestyle changes, as you correctly said. Can you just maybe highlight a little bit about exercise and vascular and cardiovascular health?
So again, the people nowadays are missing the simple basic facts. We are humans. Humans are supposed to have proper sleep at nighttime. They're supposed to eat healthy. They're supposed to move their legs. If we are missing these three simple facts, we are missing the essence of physical fitness, and this will definitely affect this. Not everything can be solved by a pill. If someone has a lot of work stress or life stress and they do not get enough sleep, and when I say enough sleep, I talk about 6 to 8 hours at night time, not starting at 2 or 3 a.m. This is too late. We're talking about nighttime. Anywhere between 8 to 10 p.m. where normal people would sleep, not the night owls. Yes, they need to get good enough sleep time. Physical activity is very simple. It's very important because it maintains the vascular health. Physical activity could be as simple as walking. Even if they do simple brisk walking, as long as it's a continuous, regular walking of 20 minutes a day would really preserve vascular health.
Thank you very much. And finally, we would like to highlight to our audience that we are here to help, we are here to support. Any concern, please don't hesitate to come and speak to us. Dr. Mohammed has a high experience in vascular diseases. You can come straight to the vascular clinic or to the urology clinic. And of course, treatments is available. Sometimes it can be as simple as just a simple advice and lifestyle modification. If you have any last word,
Thank you for saying that. Yes, we always stress on this, that here at our facility, we always try to adapt early. We are very early adapters to the latest technologies and to the techniques that we have. All the facilities and the necessary equipment are available. On my part, a lot of the invasive treatments are related to what we call endovascular or minimally invasive procedures, where we try to fix the blocked artery by the catheter-based balloons, or if there is something called the venous leakage, we try to do some injections to make the veins capable of holding blood again. So there are very minimally invasive procedures if needed. But again, as you mentioned, it might be just a simple advice that solves the issue. So yes, please feel free to come visit us. We will give you the honest advice.
Thank you very much, Dr. Mohammed. Thank you for listening. And we are here to support and help you. Anybody who needs to have a consultation, please don't hesitate to contact the number of our hospital. We wish you all a healthy, prosperous life.
Thank you. Thank you, Dr.
Thank you.
Thank you, everyone.